education and nursing implications, the nurse should be familiar with common afflictions that affect homeless patients. For example, HIV and AIDS, which are common among drug abusers. Also, respiratory illnesses such as tuberculosis and bronchitis. Also, mental illnesses such as major depressive disorder and schizophrenia, which are the big ones, as well as PTSD. Also, skin and foot problems, which are very common amongst homeless patients because of inappropriate clothes that are worn for the weather and because of ill fitting or the lack of shoes. Nurses must understand the cause and effect of all of these diseases. For example, there's a lot of debate on whether mental illness becomes prevalent in the homeless patient because of homelessness, or if mental illness is present before homelessness. Whatever the case is, it is known that mental illness increases after homelessness, and homeless people are more inclined to be mentally ill in the first place. Also, patient education should be the number one priority after safety for the homeless patient because of continuing care. Many homeless patients do not have primary care providers and so rely on inpatient visits to be told where to receive further care and where to continue medications, such as antiviral medications for patients with HIV and AIDS, inhalers for patients with respiratory illnesses, and psychiatric medications for patients with mental illnesses. Lastly, nurses should properly assess and intervene for the homeless patient just as they would with any other patient. This includes referrals to social work and case management where needed.